Good morning, Mrs. Cross. My name is Dawn. I'm going to be your nurse today, and the doctor ordered that I change your dressing. Okay, I'm going to provide for privacy there. And I'm going to wash my hands. Okay, I just need to verify your name and date of birth. If you can state those for me. Christy Cross, good. Date of birth, 8/7/58, good. And can you tell me your allergies, please? No allergies? Okay, great. I'm going to put your bed up a little bit. Okay, and I'm going to put your rail down. And I have a garbage can here at my feet. Mrs. Cross, I'm going to be working over here on my table for a minute, getting things organized. I have my sterile gloves and my clean gloves, and then the dressings that the doctor has ordered for this patient. And then I have my paper tape and my normal saline to clean the wound. I want to make sure I either have a new bottle, or if the bottle's been opened, it's less than 24 hours old. And I would know that because it would have a time, a date, and initials on it. Okay? All right, Mrs. Cross, I'm going to take off your old dressing. Okay, so I'm going to look here at your abdomen. Now, Ms. Cross, we did medicate you about an hour ago, and that pain medication worked good? Okay, great. Okay, I'm going to gently remove this tape here. Okay, I'm going to peek at my old dressing I take off, and I'm going to look at the drainage, the color, the type, the amount, and if there's any odor. Then I'm going to go ahead and look also at the incision itself. If there's staples there, you can count those, and you want to make sure the wound edges are well approximated and that the skin around the incision or wound is not red or edematous, and so on. And then we're going to put this into our red bag. Okay. All right, Mrs. Cross, I'm going to work over here on my table. I'm going to open up my sterile gloves. And I have a trash can here for the larger trash. This is going to become my sterile field. The glove wrapper has a 1-inch border that will consider to be sterile or versus non-sterile, so we'll want to stay within that 1-inch border. Okay. Now I'm going to go ahead and open up my dressings, and I want to make sure I open up the dressing back here with my elbows close to my body, and then go ahead and with a 6-inch height, go ahead and drop that onto my area. You doing okay, Mrs. Cross? Okay. Okay, and one more 2x2 here. There we go. Garbage for the ABD pad, since it's a little bit larger, I'm going to open it and peel it back, that wrapper, and keep it over here off to the side without reaching over it at any time. For my cleaning solution, my normal saline, I'm going to take the lid off and I'm going to lip it by pouring over the trash here. I'm going to pour a little bit while I turn. to clean off any germs on the rim. You put that over there with the lid, so the cap, the bottom, is on the table. Okay, I'm going to go ahead and put my gloves on. I'm going to start with my dominant hand first. I'm going to grab that glove out without touching my dressing. And I'm going to keep my hands above my waist at all times. Okay, I'm going to go ahead and move my dressings over and put these fingers underneath the cuff there. I'm going to fly my thumb away. Okay. You can fix your fingertips. I would avoid messing down here around the wrist. Just let it be so you don't contaminate yourself. Okay, I have my 2x2s for cleaning. This hand is going to become contaminated because I'm going to hold on to my saline. And I'm going to pick up my first 2x2. I'm going to pour some fluid on it. And I'm going to clean my wound. I'm going to clean straight down the center of the incision line first. I'm going to always go distal to proximal. Okay. And I'm going to get rid of that. Moisten that. And now I'm going to do the top part of the incision. Again, distal to proximal. Let that fall. And moisten my third. And I'm going to do the bottom part of the incision, distal to proximal. Get rid of that. Now, this hand is contaminated. I'm going to keep holding onto my bottle so I don't use it. And I'm going to put the new dressing on my incision. I'm going to pick up my ABD pad, place that on there. Okay, I am done with the sterile part. Now I'm going to apply my tape. I'm going to window pane, which means there's going to be a piece of paper tape at the top, sides, and bottom. And it's always nice to use the least amount of tape as possible on your patient's skin. And then the last piece, what I'm going to do is I'm going to time, date, and initial. Okay, and then that one there I'm going to put right on the outside. Okay. And you're going to make sure your patient is comfortable. We'll put our rail back up. And down. Crisscross. Do you need anything else? You have your call light. Okay, and then go ahead and wash your hands. And that completes our dressing change.